We're here to talk about pets, pet nutrition, and wellness, anything that can help our fur children live a longer, vibrant, and happier lives.
All right.
Yeah. Welcome to
Welcome
Vital
to
Pet
Vital
Life
Pet Life.
Podcast. Hey everyone, this is Donnie, your Chief Street Lady.
And I'm Dr. Amber, your official veterinarian at Vital Pet Life.
How are you, Dr. Amber?
I'm doing great. How are you doing, Donnie?
I'm doing well, Dr. Amber. Last time we talked about plants and which one aren't good for dogs or for a fur baby when we encounter them on a hike on or maybe in a walk or when in your yard. But I have a very interesting week. Like last week, Tuxedo, I mean, I think we discussed this before. Tuxedo has bladder stones, and we have it taken out last year, but we were aware early this year that he had another formation, like two or three of it. And then last week, it was very crazy because every 6 months we get x-rays to see how big or if he dissolve it, but something pretty crazy happened last week. So this is one of the things that I really want to discuss with you today, and hopefully with my experience we'll be able to educate and help for parents out there that had problems with bladder stones or how to prevent having bladder stones the fur babies.
Okay, let's get into it. I guess you can ask me questions and then I can answer you.
Sure, but I think I wanna have a brief background first of what happened. As I've said, I think we discussed this in our previous, even in blogs, in articles about in our website about having bladder stone, and unfortunately, little tuxedo here had issues with bladder stone, and it came back this year, early this year, which was kind of crazy. But we
Yeah.
were trying to make sure that we had it handled. So every 6 months I always try to get him x-rayed and see where his stones were, or has it grown or has it dissolved. But so he had his yearly dental cleaning Monday, and since it basically is within the 6 month mark time frame. So I asked the doctor, like, okay, let's just do the basics, while he's under, maybe you guys can do the physical exam. And again, if we can do x-rays on him. So again, they did everything. And then lo and behold, the doctor told us, like, hey, there's more information on the x-rays. And, are we still in the program of his urinary nutrition, like he's eating a specific food that can help him with his pH. But
Mm-hmm.
again, like the doctor was just saying, like we just need to pretty much like see how this thing goes, because some dogs apparently are not predisposed, just like Tuxie. Like he's a mutt, but some dogs are predisposed to like bladder stones because they, and then some dogs apparently have it their whole life. Like, and I could just imagine how painful it is. But
Mm-hmm.
anyhow, we came home after his like dental cleaning with a really groggy, and I think he's really in pain. And I'm like, oh no, what happened to him? Because he seems to have accident in the house. And I'm like, oh no, what happened? For like within the last 24 hours, he was peeing, and then after 24 hours, he pooped in the house. So I'm like, oh no, what's going
Mm.
on? So in my head, I'm like, maybe they stick some, the needle for, because they also do the, because it's a physical exam, so
Mm-hmm.
he has to go under urinalysis and all those stuff. So I think they use, I mean, some doctors used there's a special way in getting the urine while they're under. I think they did
Yeah.
that, and it has to be inserted in a, but I'm like, oh, maybe you know he he hurt, or they hurt him or whatever. So I was really concerned, but I don't want to have a problem, like make an issue out of it by calling the vet or yelling at them. But I'm like, because everybody, all the vets I understood are kind of tired and overwhelmed with the whole like surge of animals, especially during COVID. But I was like, okay, I'm gonna wait for like 24 hours to see how he goes. And then he that was when he did another accident, but this time it was poop, and I'm like, oh, that's kind of weird. He never does that in the house. And then second too, like he will stare at me and he twitches, and I'm like, I kept on telling Kyle like, oh, Tuxedo's been twitching, what's going on? But I'm like, I think he's still fine. He's healthy. He's eating. He's pooping like natural, normal. It's back to normal. It's not wet. But yet, he was pooping a lot that day. And I'm like, what's
Mm-hmm.
going on? Maybe it was, I also bought some cranberry supplement and it arrived right away because that was one of the suggestions of the doctor, like to give him in cranberry supplement because it helps with the pH, with the urine and UTIs. And then I also got Hydrocare. It's for it's a cat supplement to encourage them to drink water. So
Mm-hmm.
I've been giving it to him slow, and he's been drinking water. And then the next thing, I saw that he was peeing blood. So I'm like, oh my God, what's
Mm.
going on? So like me and Kyle has to rush to the vet, cancel everything, and basically, check and figure out like what's happening. Luckily, even if we didn't had was this our we didn't have any appointment, they know we were there like a few days earlier, and I have all these questions, and the whole team was there, so they just got us in, luckily, and they basically run the test. After a few hours, crazy enough, we saw on the x-ray the stones passed. So that was the bleeding.
Oh. Oh,
I
wow.
was it was the best case scenario, but it was really stressful for me and Kyle, like the 42 hours after his dental cleaning.
Yeah. So did they find any with that x-ray? Did they find that there's any more stones or they couldn't see any after he had peed?
They can't see any. So
Okay.
basically he flushed it out.
Interesting.
Yeah,
Okay.
it's crazy. So we were like, oh, that's the best case scenario, because like that was the first time I've seen him bleed in his pee, other
Mm-hmm.
than the first time that he had a surgery when the
Yeah.
oxalated stone was taken out last year.
Yeah.
But it was so weird because I'm like,
Hmm.
why was he bleeding? But he was fine. Like he was pretty healthy walking, but I think the whole pooping thing and at the same time like peeing is part of the pain. So I did my research, but the doctor's like, don't research, let's check it out. I know you will
Yeah.
find something online, but um pretty much like we'll just wait and see what's happening. Like they're 100% sure that nothing happened during the urinalysis, like he was fine. Like I think it could have been pretty much the stones like moving around, and
Mm-hmm.
maybe it, I was just worried that it's in his urethra again, because the last time that was the issue, that we have to have like a emergency surgery and they have to flush it
Yeah.
back up on his bladder so that they can open him. And that was my
Mm-hmm.
worry, but oh my God, it was great that it went out, but it was stressful for me.
Oh, yeah, I'm
So
sure.
yeah, so
Yeah.
that's why I think this is the best, like, discussion. Like, it's crazy, but oh my God, I've learned and discovered like a lot of things on how to prevent stones. Apparently, hydration is the only way. Like, even if they say, oh, their dogs are predisposed to bladder stones, but it's just really encouraging them to drink water, you
Yeah.
know?
Yeah.
Yeah.
So, I mean, bladder stones are kind of interesting and cool, but frustrating at the same time. So, bladder stones happen because of minerals, like too many minerals in the urine. The urine's really concentrated. And so it encourages those minerals to bind together. It
Mm-hmm.
has to do with pH. Struvite stones, which are really common, are almost exclusively formed because of infection. So that's not the kind of stone that Tuxie had, but struvite stones form more in the presence of infection. So dogs with chronic bladder infections they have an increased risk of struvite stones. So, first off, there's just a ton of different types of stones. Most commonly, we see the struvites and the calcium oxalates, like Tuxie had. Um, so there's some dogs that will get stones once and they get surgery to remove them, or they go on a special diet. The cool thing about struvite stones is that sometimes you can dissolve them with the special diet. So they don't always need surgery for struvites, but with calcium oxalate, like Tux had, you can't, they don't dissolve.
Yeah.
So if
Yeah.
they get, for sure, if they get big enough, they need surgery, and especially in males, but it can happen in females too. If they get one of those little stones down into their urethra and they're blocked and they can't pee, I mean, that's a medical emergency.
Yeah.
Common signs that you're going to see is increased peeing, increased drinking. Sometimes they're straining to pee. And
Mhm.
sometimes dogs will poop more frequently because they're straining to pee. Or,
Ah,
they feel like there's something going on down there and they'll strain and
yeah.
strain. And so they'll poop more because of that, not because it's a poop problem.
I know, that's what we figured
That's,
out.
yeah.
Like that day that he was pooping not normally, and we're like, "Oh my god, maybe he doesn't know what's happening." And because he never had accidents, like this guy's pretty
Mm-hmm.
good. He will wake us up in the middle of the night if he needs to go. But that day he just had to go.
Yeah.
Yeah, I'm like, "Oh my
Yeah.
gosh, like, poor guy."
And I can say many times in my career I found x-ray, or I found stones on an x-ray. The dogs weren't having any kind of urinary problems. We found them,
Oh.
we were taking an x-ray for another reason, and I'm like, "Oh, guess what? Your dog has stones." And so, some dogs are just better at hiding it sometimes, or sometimes if they're little, they're not necessarily causing symptoms. Although
Mhm.
some dogs, when you go in to do that surgery to take out the bladder stones, and if they've been in there for a long time, just the bladder wall will be extremely thick and
Yeah.
inflamed, and
Oh.
even if they haven't been showing signs. So yeah, so sometimes there's certain dogs that are prone, like schnauzers get a lot,
Oh,
Dalmatians.
wow.
There's certain dogs that are just prone to forming stones, but anybody can get them, any dog. And so depending on what type of stone they're forming, there's special diets, which Tux has been on. And
Mhm.
sometimes you can do everything right. They're on the special diet. They're not getting
Yeah.
anything else, just that diet. They're drinking plenty of water. We're doing frequent urinalyses. We're doing the x-rays, and they can still, some dogs will be managed on that and they won't form stones again. But I've definitely had patients that the owners are doing everything they can to prevent those stones, and they're just going to form over and over. Like,
Yeah.
I've had several patients that had multiple surgeries to remove stones because they were forming them over and over and over.
This is
And so,
crazy.
yeah, yeah. So it's really important to identify the type of stones so you get the right type of diet.
Mhm.
And some stones will have many layers, multiple layers, and they'll have, say they have like a calcium oxalate stone in the middle, but they got an infection and then they formed like struvite stones around. So they can
Mhm.
have multiple types of minerals in one stone. So I always recommended, when I did surgery and removed those stones, is that we send it off to a lab and we get that analysis done so we know all of the components of the stone. So that's really important. And then, like you were doing, have those urinalyses, those x-rays every 6 months, and just
Mhm.
try to catch them early,
Yeah.
if we can. So I mean, Tex is really lucky that he was able to pass them, because I've definitely seen many dogs, and again, especially in males, because they have just such a long,
Longer
skinny
one. Yeah.
urethra versus,
Yeah.
in
The
females it's
female.
short and it's kind of a straight shot to the outside, but in male dogs, their bladders on the inside, the urethra goes out through the pelvis and then down through their
I
penis, and
know.
so it has a much longer, narrower passage to travel in males, and
It,
so they're more at risk of blocking.
it was crazy because like Monday we really saw that it wasn't even as close to the urethra. It's just in the bladder.
Mm-hmm.
And then after that, like Tuesday, Wednesday, he passed it. and
Yeah.
we're like, wild. That's really wild.
Yeah.
But we're grateful, but I was really sad because I don't know what's going on. Like, I felt bad because I thought, oh, part of it too, because I was sad that I told the technician, because he had his nail trims too, and I'm like,
Mm-hmm.
oh, I just want to make sure that the last time you guys trimmed his nails, it was cut really short, and he's got black nails, and
Yeah.
not a lot of technicians really see that. The roots also grows when the nails are longer, and it's my fault
Mm-hmm.
because like, I always miss his nail trimming. He hates it, but I have to do it more often, probably every 3 weeks. But his nails just grow really fast. But
Yeah.
he was in pain. I'm not sure if it's painful for the dogs, but I think it bled while he was,
Oh
you
yeah.
know,
I mean, I definitely think that even those dogs that I've seen that weren't showing signs, but we found the stones on an X-ray, um, I think they're uncomfortable and they're really good at hiding it, or we don't pick up subtle
yeah.
signs of it. Yeah. And I mean, because you think about this little gravel like grinding around inside your bladder. I
Yeah,
just,
of course. I bet
and then,
it might be the
yeah.
same for human too, right?
Yeah. Oh, yeah.
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 Yeah. Yeah. I mean,
So,
um, even if we don't drink water, like, there are days that we're so busy, we forget to drink water. And then when we pee,
yeah.
like, you know that you need water. But I think
Oh,
with
for
them,
sure.
but
Yeah.
luckily, Taxi really communicates with me. Like, I'm one of those, like, probably like, I'm grateful that I get to work next to my dog.
Yeah.
So he's
Yeah.
always
You
next
get,
to me, and then I'm always
yeah.
like checking. So I see, like, what are the changes, and he stares at me and tells me like, "Hey, lady, I'm not
Like
feeling well."
yep. Something's not right here, mom.
Yeah. Yeah, so yeah, we were really like grateful that it happened. But maybe, Dr. Amber, other than the symptoms, for dog parents, right, like you mentioned that schnauzer, I learned over time that because Tuxedo has some American Staffy in him. At the same time, he also have a Boston Terrier in him. He's a really like mutty mutt. And then
Yeah.
and then apparently like this breeds too are pretty prone to bladder stones. So
Mm-hmm.
I mean, what are the other than like hydration, right? Is there like I know you cannot really tell how, I mean, we will just do the best as we can, but as I said, what are the things that as a dog owner or a parent can, more like a precautionary thing,
Yeah.
like
Yeah.
other than drinking water?
That's a good question. So, some people have done like the water fountains and used distilled water so that they're not adding minerals through the water. And if they're on a well balanced, high quality diet, that shouldn't be a problem to drink distilled or filtered water. Um, I don't recommend putting them on a special diet just because they're a predisposed breed. Like I would never say a schnauzer, like you need to be on this urinary diet,
Yeah.
because the urinary diets, they change the pH, they dilute the urine,
Mm-hmm.
um, and by making them drink more water. But if you change the pH too much, then you can cause another type of stone to form. So some
Oh,
stones form in really acidic urine, some form in really alkaline urine, and so you don't in a dog who doesn't have stones, I would never say like you have to put
yeah.
them on a urinary diet.
Yeah.
Only if they have a history of stones
Mm-hmm.
would I put them on a special diet. But being, super vigilant about any of those signs. Um, and it's actually a standard of practice now that if a dog is showing urinary signs and you take them to the vet, they're going to recommend a urinalysis for sure. And they're going to recommend x-rays. That's kind of a gold standard now, is if they're having any kind of urinary signs, then we take an x-ray, even at the first UTI or signs of a UTI, that if you're taking your dog into a clinic, a veterinary clinic, because they have urinary signs, they should do a urinalysis and an x-ray, even the first time, if it's their first UTI. I've been burned several times, many times, where, I always recommended an x-ray. Some owners chose to decline, and we would still
Mhm.
treat what we could on whatever we found on the urinalysis. But I had many patients where we treated them, it looked like there was an infection. We treated them with antibiotics, symptoms cleared up for a while. And then, a month or two down the road, now they're having symptoms again. So we're treating with another round of antibiotics based on our urinalysis. And then, finally, we really need to take x-rays. And we took an x-ray and there's a stone in there. So we've been treating this whole time, not knowing that there's a stone because we didn't take an x-ray. Now, just
Exactly.
a little caveat, there's some stones that don't show up on x-rays. Most urinary stones will show up on x-ray, but sometimes they don't. So if you're
Mm.
having, a dog who has abnormalities in the urine, multiple x-rays are showing a negative, then I would recommend an ultrasound. An ultrasound should pick up those stones because, we're putting the sound waves into there and they're bouncing off the stones. If there's continuing urinary signs, even if we're not seeing stones on an x-ray, then it just needs to be investigated a little further.
Yeah. I think that's the best way to be more proactive, I guess,
Mm-hmm.
especially if you see signs. So, again, like the signs of UTI or urinary problems will be like straining,
Yep.
drinking water more.
Straining, drinking a lot of water, peeing more. So even if they're
Hmm.
not having accidents in the house, so accidents for sure in a dog who's been potty trained, but even if
Hmm.
they're not having accidents and you notice, gosh, they're asking to go out all the time, like they need to pee all the time. They're straining. Certainly if you see blood in the urine,
Yeah.
all of those things need to be investigated. And
Wow.
another gold standard type of thing would be if we're doing a urinalysis, we should collect it sterilely with a needle through the bladder. That's just the best way. If they're peeing on the floor and we're collecting it, or even if they're peeing in a little collection device as we're walking them, we're getting contamination from the outside. If we
Mm.
see bacteria in the urine when they've peed like that, we don't know. Did it come from inside the bladder? Because normal
Oh, yeah.
urine is sterile. There's no bacteria in the urine normally. But, when they
Mm.
pee it out, it collects from the outside. So if we're taking a sterile needle and we're collecting it sterilely through the bladder wall, it sounds scarier than it is. They usually tolerate it pretty well. But,
Yeah.
and we get a sterile sample and we do a urinalysis and we send it off for a culture and we're getting
Mm.
bacteria, then we can be more confident that it's actually an infection. Most
Mm.
people will come in to the clinic and say, I think my dog has a bladder infection. And certainly we treat a lot of those, but there's stones, there's tumors, there's
Yeah.
inflammation, there's, other things that could be going on too. So
Yeah. Can you see tumors out of the urinalysis or no?
Not always. I mean,
Uh,
occasionally you can see when you're doing a urinalysis. So there's a few components to a urinalysis I'll go over real quick. So there's a chem strip where you're putting a drop of urine on each of these little pads, and it's looking for it's looking for the pH, looking for the chemical components in the urine, and the concentration. We're looking at that. And then what we do is we take a little vial of the urine and we're going to put it in a centrifuge. It's going to spin it really fast and concentrate everything down to the bottom. So if you see white blood cells, red blood cells, crystals. So sometimes dogs, even if they don't have stones, they can have mineral type of crystals in their urine. So we're looking for all of that under a microscope.
mm.
Um, and we're looking for bacteria. We're looking for what types of cells. So occasionally they can, if they have a tumor, a cancerous tumor in their bladder, then occasionally you can see those cancerous cells on that urinalysis if they happen to shed off.
Oh.
Yeah. So that it's typically not diagnosed that way. Sometimes you just get lucky and you find these cells on that initial urinalysis. I would say most of the time, if there's something like a tumor in there, it's diagnosed occasionally on x-ray, but more often on ultrasound. So
Ah.
again, if there's just no sign of an infection, we haven't seen stones, but they're still having these chronic urinary symptoms, then I would recommend just
Ultrasound.
investigating it further and doing an ultrasound. Yeah.
Yeah, that's amazing. Yeah. Well, luckily for Tuxedo, the results of his urinalysis came back clean. So
Mm-hmm.
I think it's just
Interesting.
really, yeah, it's just the stones. So it's kind
Yeah.
of wild, but I guess, it's the best case scenario for us. And yeah, we're just gonna have another, healthy, like make sure that everything that we're supposed to be doing will be done. Well, I'm always checking on him wherever he goes. Like
Yeah.
he can't dig on the mulch. Like when he goes out in the yard, like because the doctor was like, "Oh, make sure too that he doesn't eat dirt." I'm like, "Oh no, that's what he loves."
Yeah. Yeah.
Yeah, I
Definitely
mean,
when they're on a special diet, I would say nothing else by mouth. So no
yeah.
treats, people food, just because it's kind of, we're on a special diet for a reason, and if we're giving him other things, then we're not realizing the full potential of the diet, and we could be messing up his pH and everything with
Oh,
anything
okay.
else. Yeah.
Yeah. All right. So no more treats then. Oh no.
Although, some dog, like you can use their regular kibble as a treat. If it's in the bowl, it's just their food. But if it comes from
Mhm.
your hand, it's a treat.
Yeah. I mean, I've been giving him like fruits. Like he loves to eat blueberries. Like
Mm-hmm.
they incorporated it on his diet. He gets like customized food, and he they put like blueberries because like he loves blueberries. And
Yeah.
then a little bit, we're just doing the best we can, but I
Yeah.
think the drinking really is one of the things that I've noticed with him. Like he doesn't drink as much water as
Yeah.
he should be doing. And then now with for the past like week, literally I've seen him like drink a lot of water. Even with just like a few minutes of like playtime, he'll come in and drink a lot of water. I'm like, good job, because that's what you need to do.
Yeah. Yep. Dilute out that urine as much as you can.
I know. It's interesting too that so he was given like Hydra Care. It's like a goo that it's pretty much like salt, I guess, that can encourage, like it's purely for cats. So I think this is one of the questions too that I mean I would want to talk about in this episode, is that there are supplements that can be good for cats that can also help dogs. Like I don't
Yeah.
give it to him the full pack because I mean he's bigger than a cat, but a little bit. As long as he gets to drink water, because it
Yeah.
encourages him to drink more. Yeah.
Yeah. I actually, Hydrocare is pretty new on the market in the last few
Mm-hmm.
years, if I remember right. And
Mm-hmm.
using cat products in dogs is safer than using dog products in cats. Like cats are just their
Oh.
own special thing. And so, um,
They're very
yeah,
unique. Ah, that's awesome. Yeah. Like if it needs to be if it's something that we can help people to encourage the dogs drink, but always
yeah,
always talk to your vets. I mean,
yeah,
it was given to
definitely
Tuxedo. Yeah. Yeah.
consult with your
It was
veterinarian.
good. Yeah. All right. Well, thank you so much, Dr. Amber. Like those are really wonderful insights on, how I can take care of Tuxedo more, and, maybe hopefully with the experience, like we can educate or give light to bladder stones in animals, or
Yeah.
especially dogs. So that's it for today's topic. Don't forget to follow our channel for more talks about pets, tips, advice, and fun stuff.
Happiness, vibrance, and longevity for our fur babies and our planet.
Once again, thank you for tuning in. This is Donnie, your Chief Greek Lady at Vital Pet Life.
And this is Dr. Amber, your official veterinarian at Vital Pet Life. Thank you for listening in and have a possum weekend.
Till next time. Bye.